If early symptoms are ignored, muscles may break down in severe cases, leading to inability to walk and potentially life-threatening consequences. Thank you for watching the video. This is YouTube Medical University. I will explain in detail about rhabdomyolysis, which is the most serious side effect of the medication that many people take to lower cholesterol. It is said that 1 in 3 Japanese people have high cholesterol, and there are many people taking medication to lower their cholesterol. In my outpatient practice, I see many people taking cholesterol medication, but many of them are not aware of its side effects. The most serious side effect, rhabdomyolysis, is a disease where your muscles break down, and as a result, you may lose the ability to walk. Your kidneys may be damaged to the point where you need dialysis, and in some cases it can even be life-threatening. In fact, the Ministry of Health, Labour and Welfare has issued a warning document about rhabdomyolysis caused by cholesterol-lowering medications. Of course, these medications are prescribed because they are necessary, but in reality, due to time constraints in outpatient clinics, it's often difficult to explain the side effects in detail. Please watch this video and learn so that you don't miss the signs and let things get worse. In the second half of the video, I'll introduce 7 ways to lower cholesterol through diet without relying on medication as much as possible, so please watch until the end. Here at YouTube Medical University, I share information from a doctor's perspective about how you can become healthier starting tomorrow, and about preventive knowledge to avoid getting sick in the first place. With so much information out there, that's why it's so important to have at least one reliable source of information in today's world. If you don't mind, please subscribe to the channel so you won't miss any new videos. I'd really appreciate it. Now, here's today's agenda. First, in the first section, I'll explain what statins are as a medication. In the second section, I'll introduce 3 early symptoms to help you detect rhabdomyolysis as soon as possible. In the third section, I'll talk about when rhabdomyolysis is more likely to occur and share 3 characteristics of people who are more prone to it. Finally, in the fourth section, I'll explain how to lower cholesterol through diet without relying on medication. First of all, what kind of role does cholesterol actually play? Because you often hear terms like high cholesterol or bad cholesterol, many people think cholesterol equals something bad, but that's a big misconception. Cholesterol is actually an important component that forms the membranes of our cells. In addition, it's also a material used to produce hormones in our body and serves as a building block for vitamin D, which is essential for strengthening our bones. So, without cholesterol, we wouldn't be able to live healthily. Low-density lipoprotein cholesterol is called bad cholesterol, and high-density lipoprotein cholesterol is called good cholesterol. But in reality, there's no good or bad. The difference between them is simply the amount of a substance called lipoprotein. Among them, low-density lipoprotein cholesterol is said to be bad because it transports cholesterol produced in the body through the blood vessels and stores it in various organs, which can potentially promote arteriosclerosis. However, this cholesterol is actually an important material for our body, so we can't live without it. It's true that if your low-density lipoprotein cholesterol is too high, in the future, the risk of myocardial infarction or cerebral infarction increases, leading to many people being prescribed cholesterol-lowering medications. As a doctor, I also sometimes prescribe these medications. But lowering cholesterol, medications like statins are often prescribed, but in reality, these drugs are frequently given even if cholesterol levels are only slightly above the standard range. According to the actual guidelines, it's not recommended to immediately prescribe medication just because the numbers exceed a certain level. Instead, factors such as whether the patient has had a myocardial infarction or cerebral infarction, whether they have diabetes, or whether they smoke are considered. Underlying conditions, lifestyle habits, and gender are also considered. It is recommended to carefully determine whether medications should be prescribed. Therefore, in many cases, I see people being prescribed medication even though generally it shouldn't be given just because their numbers are slightly above the standard range. I believe that it's always best to take the minimum necessary amount of medication. For those of you watching this video who are currently taking medication, please make sure to consult your primary doctor about why the medication was prescribed and what target values you should aim for. Cholesterol-lowering drugs like statins are prescribed because having high cholesterol increases the risk of arteriosclerosis. These statin medications are generally called something statin, or by their generic names like Crestor. These medications work in the liver. These medications work by inhibiting the enzymes that produce cholesterol in the liver, reducing the amount of cholesterol that is made. Normally, cholesterol is absorbed from food and also produced in the liver. But when the liver can't produce it, the cholesterol in the blood, the body works to return cholesterol to the liver, which lowers cholesterol levels when you get a blood test. That's how these medications lower cholesterol. However, on the other hand, there is a risk of a serious side effect called rhabdomyolysis. What we know is that when rhabdomyolysis occurs, our muscle cells break down and dissolve into the bloodstream. So in this second part, I will talk about rhabdomyolysis, what symptoms appear when muscles start to break down, and how to detect it as early as possible to keep it mild. I'll introduce 3 early symptoms to watch for. This rhabdomyolysis. Once developed, the fatality rate of this condition is up to 10%, making it very frightening. If you experience even one of the following symptoms, stop taking the medication immediately and consider seeing a doctor right away. The first of the 3 early symptoms of a rhabdomyolysis is muscle pain or muscle fatigue. Since the muscles are breaking down, it's easy to understand why you would experience muscle pain. A characteristic of rhabdomyolysis is that it tends to affect muscles close to the center of the body and often occurs on both sides. So, please remember that large muscles close to the body, such as the shoulder muscles, thigh muscles, lower back muscles, and calf muscles, are the ones that tend to be affected. When you actually examine a patient, since the muscles are damaged, pressing firmly on the affected muscles will cause pain, which is another characteristic. However, one thing to be careful about is that about 5% of people who take this medication called statin may experience symptoms like muscle pain or cramps, like when your leg cramps up, even though it's not rhabdomyolysis. These symptoms usually appear within about a month after being prescribed statin medication. So, not everyone who has muscle pain has rhabdomyolysis. However, these can also be early symptoms of rhabdomyolysis, and ignoring the pain can be dangerous. So, if you develop these symptoms after taking the medication, I think you should see a doctor and consult with them right away. The second of the 3 main early symptoms of rhabdomyolysis is a change in the color of your urine. This might be a surprising symptom. In rhabdomyolysis, the muscles break down and leak into the bloodstream. You can imagine that muscles are red, right? The redness from the muscles leaks into the blood, and then it comes out in the urine, making the urine turn a reddish-black color. Please remember this. In fact, this is called myoglobinuria. Myoglobin is a substance that makes up muscles, and when it leaks into the bloodstream and then into the urine, that's why the color of your urine changes like this. Please remember that your urine may become darker and brownish than usual, and sometimes even reddish black. This myoglobin passes through the kidneys and becomes urine. Myoglobin puts a heavy burden on the kidneys, so people who develop rhabdomyolysis can quickly progress to kidney failure or kidney damage. If you are taking a medication called statin, and you notice these symptoms, you should go to the hospital right away and get a urine test. The third early symptom of rhabdomyolysis is swelling in the legs. I've talked about this many times on YouTube Medical University, but when the kidneys are damaged, swelling in the legs appears, right? As I mentioned earlier, rhabdomyolysis puts a heavy burden on the kidneys. It's like the filters in the kidneys get clogged and they gradually lose the ability to filter and produce urine. Since the body can't get rid of water, fluid builds up inside, and because of gravity, swelling starts from the feet, which are the lowest part. So, if you have symptoms like difficulty urinating and swelling in your feet, it's possible that your kidney damage has already progressed quite a bit. I've also summarized other symptoms of kidney problems in this video, so I'll put the link in the description. Please check it out. Now, let's review the first and second periods. Cholesterol isn't necessarily a bad thing. It's actually an important material for the body. When you take a medicine called statin, your liver stops producing cholesterol, which results in lower low-density lipoprotein cholesterol. However, I also explained that a side effect of this medicine can be rhabdomyolysis, which causes muscle pain, changes in urine color, and swelling in the legs. You might be wondering, what about these symptoms? I took a different medicine and had similar symptoms. For concerns like these, I host a YouTube live session every Tuesday at 9 p.m. where we discuss health. Please subscribe and join me each Tuesday at 9 p.m. to think about health together. Thank you. Now, in the third period, rhabdomyolysis. When does it tend to occur and who is at risk? I will introduce 3 main risk factors for rhabdomyolysis. 3 main risk factors for rhabdomyolysis. The first one is dehydration. Rhabdomyolysis can occur as a side effect of medications like statins, but it can also happen due to heat stroke or when muscles are severely compressed for a long time, such as being trapped under debris during an earthquake. When muscles are compressed and the muscle cells break down, myoglobin leaks from the muscles into the bloodstream and is excreted in the urine. This is what causes rhabdomyolysis. It's also said that dehydration and heat stroke, which are common in summer, can lead to rhabdomyolysis. Dehydration itself can reduce blood flow to the kidneys and cause kidney problems. In these situations, you are more likely to develop rhabdomyolysis. So if you are taking statin medications, your risk may be even higher. That's why it's important to be careful about dehydration and make sure to stay well hydrated as a preventive measure. The second of the three main risks for rhabdomyolysis is using stronger types of statins. Stronger statins, sometimes called strong statins, are prescribed for people with very high cholesterol that doesn't go down easily. However, these people are at higher risk for rhabdomyolysis. Lowering cholesterol too much may not be good, as prescribing strong medications just to lower cholesterol as much as possible increases the risk of side effects. It's crucial to lower cholesterol to an appropriate range without taking overly strong medications. That perspective matters. In the past, my cholesterol was high and I took that medication, but now my eating habits have improved and my cholesterol is already quite low. It's quite common to consider switching to a milder medication, so please consult your primary doctor to see if the medication you're currently taking is the right strength for you. In fact, it's said that the strongest medication for lowering low-density lipoprotein cholesterol carries a risk of kidney damage that's 75 times higher than for those not taking any medication. There have been reports of rhabdomyolysis occurring even during clinical trials, so you need to be very careful. The third risk factor for rhabdomyolysis is for those who are taking medications other than statins that have rhabdomyolysis as a side effect. In fact, some fibrates, which are often prescribed to lower triglycerides, and certain antibiotics used to fight infections also carry a risk of rhabdomyolysis. Some psychiatric medications and certain drugs for Parkinson's disease also carry a risk of rhabdomyolysis. As I've said many times, these medications are prescribed because they are necessary, but it's always better to take as few medications as possible. It's important for us as healthcare professionals to keep considering whether there are any medications that can be reduced or switched to milder alternatives. But it's not always easy. Hospitals often don't explain side effects in detail, so I think it's important for you to have some knowledge yourself. That's why reducing the number of medications that carry risks even a little can help with prevention. When you have a blood test, there is a marker called creatine kinase. This measures a muscle enzyme, and if you develop rhabdomyolysis, the value can exceed 5,000 or even 10,000, reaching extremely high levels. The medications causing this condition: by stopping the medication, the condition will gradually improve over a few weeks. However, if it's not detected early, or if it's extremely severe, it can put a strain on your kidneys and cause them to temporarily stop functioning, which can be life-threatening. In some cases, dialysis may be needed to support kidney function. Sometimes the kidney damage is only temporary, but there are cases where kidney function doesn't recover and dialysis is needed in the future as a result. So please, I hope you'll be careful not to miss the early symptoms I explained in the second part. Now, in the fourth part, thank you for waiting. Some of you may be wondering if there's a way to lower cholesterol through diet without relying on medication. There are all sorts of foods and supplements being recommended out there, but this time I'll talk about what kind of diet is generally effective based on actual data. I'd like to carefully select and introduce 7 foods that have data showing they can lower cholesterol and reduce the risk of future heart attacks or strokes. 7 diet tips to reduce cholesterol. The first one is phytosterols. I think many of you have never heard of phytosterols before. This is also called plant sterols. Phytosterols are simple. They are plant-based oils found in plants, fruits and grains. They are found in corn, sesame, peanuts, soybeans, canola oil, sesame oil, nuts, avocados, chocolate, and so on. What's amazing about these phytosterols is that they inhibit the absorption of fats we take in through our mouths. Even if you consume fats, more of it is excreted as is. So there is a lot of data showing that cholesterol is less likely to increase as a result. For example, even if you take cholesterol-lowering medication, your low-density lipoprotein cholesterol may still be over 130. There is data showing that in patients, the group that was given 5.1 grams of phytosterols per day had lower total cholesterol and low-density lipoprotein cholesterol compared to the placebo group that was not given anything extra. In addition, a German study involving 85 patients with type 2 diabetes used a diet containing 8% phytosterols. They had them consume 20 grams of this diet. After 12 weeks, the people who were taking these phytosterols showed a reduction in the increase of bad cholesterol. In addition, in an Iranian study, foods containing phytosterols, sesame oil, consumed at 2 tablespoons daily for 12 weeks, has been shown to decrease total cholesterol levels. It is a familiar ingredient in Japanese cuisine. You can use it in salads or stir-fries, and just by replacing your usual salad oil with sesame oil, you can expect a cholesterol-lowering effect. Lower cholesterol. The second of the 7 dietary methods is soluble dietary fiber. Did you know that there are 2 types of dietary fiber? Soluble and insoluble? As the name suggests, soluble dietary fiber dissolves in water, while insoluble dietary fiber does not. Both are great for improving bowel movements, but since insoluble fiber doesn't dissolve, it increases the bulk of your stool and helps improve bowel movements. Contrastingly, soluble dietary fiber dissolves in water, softening your stool. It also feeds your gut bacteria, aiding in regulating your digestive system. These are some anticipated benefits. Even in studies called meta-analyses, which collect and analyze many highly reliable papers, it has been reported that the more soluble dietary fiber you consume, the more your total cholesterol and low-density lipoprotein cholesterol decrease. In fact, increasing dietary fiber intake by 1 gram can reduce bad cholesterol by an average of 2.2 points according to reports. That's an impressive outcome, don't you think? Please try to consciously include soluble dietary fiber in your diet. Getting enough soluble dietary fiber requires conscious effort. Foods rich in soluble fiber are often sticky or slimy, like natto, kelp, wakame, mozuku, mekabu, and Chinese yam. Try incorporating these foods, as their sticky and slimy texture indicates a high soluble fiber content. These are the kinds of foods you should eat. Natto is especially recommended as it's rich in protein. It also contains both soluble and insoluble dietary fiber. Plus, it's rich in vitamins and minerals, and it also contains an enzyme called nattokinase. This substance is even said to help thin the blood these days. Another highly recommended source of soluble dietary fiber is wakame seaweed. Wakame is especially rich in minerals and is low in calories. If you buy dried wakame, it's easy to store, and you can eat a lot of it for a low price. Wakame is mostly dietary fiber, so eating it can help slow the rise in blood sugar after meals. And there is even data showing that wakame itself can help suppress the increase of bad cholesterol. It's said that even dried wakame is just as effective as fresh wakame, so why not try adding it to vinegar dishes or mixing it into miso soup? The third recommended way to lower cholesterol is flaxseed oil. I think most people have heard of flaxseed oil but haven't really tried eating it. Actually, I hadn't eaten much of it myself either. The truth is, flaxseed oil contains alpha-linolenic acid, an omega-3 fatty acid that helps lower bad cholesterol, which is why it's getting a lot of attention. In a certain Japanese study, the participants were... One group was given 10 grams of flaxseed oil containing alpha-linolenic acid, while the other group was given 10 grams of corn oil, which contains almost no alpha-linolenic acid. They were asked to take it once a day, with dinner, and then continued this for 1 to 3 months. There is a study that looks at how cholesterol changes. Here is the graph showing the results of that study. The black dots represent the decrease in cholesterol for those who took flaxseed oil. The white dots represent corn oil. After 4 weeks or 1 month from the start of the study, it is said that the people who consumed flaxseed oil had a 25.8% decrease in low-density lipoprotein cholesterol. In other words, that means their cholesterol levels dropped by about 1/4. What do you think about that? I think it's a very promising study that just by taking 10 grams once a day, cholesterol dropped by 1/4. So, how should you take 10 grams of flaxseed oil? I recommend putting it on salads. The reason is that flaxseed oil is said to oxidize easily. So, if you heat it, it will oxidize and the effective components are thought to decrease. To enjoy your salad, sprinkle some salt and olive oil, then pour flaxseed oil over it. Flaxseed oil doesn't have a strong taste and adds richness to the salad, making it more palatable. Give it a try. Personally, I recommend chopping up block cheese like Roquefort cheese and sprinkling it on your salad. It adds richness and makes the salad milder and tastier. It's easier to understand and remember if you consider the data and reasons behind it. You can find all kinds of content on YouTube. Medical professionals are sharing information. There are many useful things, but some of them are incorrect. I hope we can continue learning together so you don't end up regretting getting the wrong information. If you try this kind of diet, will it help lower it? These kinds of is medication necessary? If you have any questions, please leave a comment or join our YouTube live stream every Tuesday at 9 post meridian where I answer questions. I hope you'll join us. Also, please subscribe to the channel so you don't miss any new videos. It really encourages me. Now, let's continue. The fourth of the 7 ways to lower cholesterol through diet is soybeans. Soybeans lower cholesterol? I think many people haven't heard much about that. Even on other YouTube videos, it's rarely explained. The nutrients contained in these soybeans, isoflavones, are attracting attention for their potential to lower total cholesterol and bad cholesterol in the human body. Let me introduce a study. The subjects were given ground beef to eat, but one group had ground beef containing plant-based soybean oil, while the other group ate regular ground beef. Surprisingly, the results showed that those who ate the ground beef with added soybean oil had their bad cholesterol decrease by 9.3% and their total cholesterol decrease by 14.9% compared to those who ate regular ground beef. Even though it's said that eating meat raises cholesterol just by adding soybean-derived fats to the meat, the cholesterol actually decreased, which suggests that soybeans themselves may have a cholesterol-lowering effect. But for those who say it's not easy to add soybean fats to the meat you usually eat, honestly, I can't do that either. So, an easy, affordable way to get soybeans is by eating natto or tofu. Let's try switching to meals with a focus on Japanese food. I especially recommend adding tofu or natto as a side dish for dinner. Even just doing that can increase your soybean intake, so please give it a try. Soybeans themselves are rich in protein, which is a very important nutrient for building our bodies, so for that reason as well, I recommend eating soybeans. Personally, I recommend putting chopped green onions and an egg yolk on natto, then pouring it over rice. It's really delicious. 7 dietary methods to lower cholesterol. The 5th one is fish. Have your parents ever told you to eat plenty of blue-backed fish because it's good for your brain? It's actually known that these fish are rich in docosahexaenoic acid, and eicosapentaenoic acid, which are important for building the brain. That's why people say eating fish high in docosahexaenoic acid and eicosapentaenoic acid can make you smarter. Whether you believe it makes you smarter or not is up to you, but there is more and more data showing that it lowers cholesterol and reduces the risk of diseases caused by clogged blood vessels. In a highly reliable meta-analysis that combined 11 studies, it was found that eating fish more than 4 times a week can lower the risk of heart attacks by 21%. There is data showing that it not only lowers cholesterol, but also reduces the risk of heart attacks that can happen as a result. And interestingly, it has also been shown that the more fish you eat, the lower your risk becomes. Specifically, it said that for every 100 grams of fish you eat per week, your risk of heart attack decreases by 5%. So, if you eat 200 grams, your risk decreases by 10% and so on. However, there is something you need to be careful about. Just because docosahexaenoic acid and eicosapentaenoic acid are abundant, if you eat a large amount of fish, there is a risk of mercury poisoning. In fact, it's known that fish contain trace amounts of mercury, and by consuming too much of this mercury, the risk of mercury poisoning increases. If you get mercury poisoning, you may experience nausea, stomach pain, diarrhea, dizziness, blurred vision, and your kidney function can suddenly deteriorate. You can develop severe symptoms. In fact, it's known that certain fish contain high levels of mercury, such as splendid alfonsino, swordfish, bluefin tuna, and big-eye tuna, and also whale. These types of fish contain relatively high amounts of mercury, so it is recommended to limit your intake to 80 grams per week. On the other hand, if you're looking for fish that are high in docosahexaenoic acid and low in mercury, herring and Atlantic mackerel are good options. And as for shellfish like oysters, as well as salmon, sardines and sea bream, these fish are also high in docosahexaenoic acid and are considered to have low mercury content, so please keep that in mind. Personally, one way I recommend eating them, and something I do myself, is canned mackerel. Canned mackerel is very affordable. Plus, it's already seasoned, so you just open the can and eat. By eating canned mackerel for lunch during your busy workday, you can help control your cholesterol. Getting protein from fish can help recharge your energy, so there are a lot of benefits. I really recommend adding canned mackerel or sardines to your daily routine. The sixth way to lower cholesterol through your diet is nuts. There is solid data about nuts, just like with mackerel. Especially walnuts contain omega-3 fatty acids, which I mentioned earlier with flaxseed oil, and are well known for lowering cholesterol. Other nuts are also rich in monounsaturated fatty acids, which are also famous for reducing cholesterol. So, just like with mackerel, there is a lot of solid data about nuts, and they almost certainly lower cholesterol and help prevent clogged blood vessels. It's said that they can also lower the risk of death. Let me introduce a large-scale study. In this study, they compared people who didn't eat nuts with those who ate nuts more than 5 times a week. They found that people who ate nuts more than 5 times a week had a 14% lower risk of heart attacks and strokes. By the way, the nuts included in this study were peanuts and walnuts. Since this study involved more than 2 million people, it's considered highly reliable. Personally, I recommend eating nuts in small packets. I recommend eating nuts in small packets as a substitute for snacks. My desk drawer at work is full of these small packets of nuts. What's good about these small packets of nuts is that they're affordable. Since you have to chew them quite a bit, you feel satisfied after eating, and unlike eating snack foods, your hands don't get dirty. So you can eat them even while working when you get a little hungry. Also, most snacks tend to be high in calories, but by replacing them with nuts, you can reduce your total calorie intake. As a result, it's said that cholesterol levels decrease, which lowers the risk of heart attacks and strokes. So please check out small packets of nuts on sites like Amazon. Personally, I recommend walnuts because they contain omega-3 fatty acids. What do you think? Lowering cholesterol. The seventh and final diet method is the Mediterranean diet. At YouTube Medical University, we've emphasized this many times in the past. The Mediterranean diet not only lowers total cholesterol, it also lowers triglycerides in people with diabetes and fundamentally reduces the risk of heart attacks and strokes, which are the end results of arteriosclerosis. That's not all. It's a superfood that has also been shown to reduce the risk of dementia and certain types of cancer. The Mediterranean diet is the cuisine of the Mediterranean coast of Europe, and because seafood is abundant there, it's centered around fish. It also focuses on vegetables, fruits, soy products, and dairy products. That's the kind of diet it is. There is little red meat or salad oil, and the focus is on fish and olive oil. And this habit of eating fish and soy is very familiar to Japanese people. Natto, tofu, and blue-backed fish that I mentioned earlier are also included in the Mediterranean diet, and each of them helps lower cholesterol. That's what we can expect. In fact, in a highly reliable study called a meta-analysis that combined 6 trials, it was found that in people who are obese, they gathered 2,650 people and divided them into groups to eat either a Mediterranean diet or a low-fat diet. As a result, the group that ate the Mediterranean diet had an average total cholesterol level that was 7.4 points lower. It's understandable if cholesterol drops compared to people who eat nothing, but isn't it surprising that cholesterol dropped even compared to the low-fat diet? For those of you who watched this video to the end, I'd like to introduce some specific Mediterranean diet menus. There's an official LINE link in the description. Please add me as a friend there and just type Mediterranean diet. Then I'll automatically send you a free chart summarizing recommended Mediterranean foods and the amounts you should eat. It's completely free, so please feel free to receive it if you'd like. Now, let's review the second lesson. Here are 7 dietary methods to lower cholesterol, and the first is phytosterols. I introduced oils found in plants, fruits, and grains. Sesame oil might be the easiest to try. The second is soluble dietary fiber. I mentioned that the more soluble fiber you consume, the more your cholesterol may decrease. Please try to consciously include foods like natto, wakame seaweed, and other sticky foods in your diet. The third is flaxseed oil. Flaxseed oil contains I explained that alpha-linolenic acid may help lower low-density lipoprotein cholesterol. Try to consume it without heating it as much as possible. I recommend using it as a salad dressing or drizzling it over your dishes to finish. That's how I suggest eating it. Fourth, soybeans. I introduced a study showing that simply adding soybeans to ground meat can lower cholesterol levels. By being mindful of Japanese cuisine and adding a dish like natto or tofu, your cholesterol may decrease. Fifth, fish. I mentioned that eating fish 4 times a week can reduce the risk of heart attacks, and that for every 100 grams of fish consumed per week, the risk decreases by 5%. And then, you need to be careful about mercury, so it's best to choose fish with low mercury levels. As for recommended ways to eat fish, I mentioned that canned mackerel or sardines are the easiest options. Sixth, nuts. By eating nuts more than 5 times a week, the risk of heart attacks and strokes goes down. As for a recommended way to eat them, I suggested switching your usual snacks to small packets of nuts. Among nuts, I especially recommended walnuts because they are rich in omega-3 fatty acids. Seventh, the Mediterranean diet. Not only does it help with cholesterol, but it also prevents blood vessels from getting clogged. The Mediterranean diet is believed to reduce risks like clogged arteries, high triglycerides, dementia, and cancer, so try to incorporate it daily. Diet is about frequency. While you may crave greasy or sweet foods sometimes, slightly reducing their frequency and increasing the meals I shared today will gradually lower your cholesterol levels. How was that? This time, I discussed a little-known issue that even the Ministry of Health, Labour and Welfare is cautioning about. I introduced the dangerous symptoms of rhabdomyolysis. To lower the risk of rhabdomyolysis even a little, it's important to prevent dehydration, switch to milder medications, reduce the number of risky drugs, and catch the early symptoms. I also explained the importance of these points and how to improve your condition through diet instead of relying only on medication. In this way, at YouTube Medical University, we discuss early disease symptoms and, more crucially, how to prevent illness and the types of what kind of diet is good for you. I explain these things responsibly from a doctor's perspective. If you found this video helpful, please hit the like button and share your thoughts in the comments section. Also, don't forget to subscribe to the channel so you don't miss any new videos. In the description box, I've included information about what cholesterol levels actually require taking statin medication, which can be a bit complicated. I've explained it in a previous video, so please check it out if you're interested. I'll see you in the next one. The Secrets to Living Without Aging Past 70, which I learned from my patients as a general practitioner, became an Amazon bestseller in 4 categories and hit number 1 in the gift ranking. These are lessons I've learned from my patients while working as a doctor. I've compiled important ways of living and health methods into one book. It's a book that will make you think, I want to live a healthy life like this too. It's on sale now with great reviews, so check it out.